Good morning, everybody. Thank you very much for joining us here this morning for our session with Mental Health Ireland and Employers for Change. My name is Christabel Feeney. I'm the Director of Employers for Change at the Open Doors Initiative. At the start of all of our events, we give a short visual descriptor of ourselves. So I'm a white female with blonde shoulder length hair in a wave today. I have blue eyes and I'm wearing a black top with a black jacket and black trousers, seated with the door behind me with a small table and a potted plant. I'm absolutely delighted to be here this morning to be talking to all of you along with Finola Colgan from Mental Health Ireland about strategies to support mental health and wellbeing at work. We know that mental health difficulties is something that will affect each and every one of us, possibly at some point in our lives. It's estimated that 1 in 4 people will actually be impacted by mental health illness at some stage during their lives. So this is a really, really important conversation that we're having here today. For those of you who haven't joined any of our events before, I just want to give you a quick idea of what we do at Employers for Change. So we're an employer disability information service, and we support employers on all areas of disability to support them in being much more inclusive of employees and potential employees with disabilities. You can get lots of more information about the work that we do at employersforchange.ie. For this morning's session, you can enable captions if you'd like to use those. You will also see that we have Catherine White, who's an ISL interpreter with Bridge Interpreting, who's joining us here this morning as well. So without further ado, I'm going to pass over to Finola, who's going to give us some really great real-life examples of what we can do in the workplace to ensure that we're supporting people's mental health and well-being. Thanks very much, Finola.
A pleasure, Christabel. And, we met up in Tullamore last autumn when there was a big information session around supporting people with disability. And the word disability in itself is an interesting word, because if you take away the DIS, what are you left with? You're left with ability. And that's what we all have. And sometimes words, unfortunately, kind of create labels, but we must, it's very important not to have labels that are negative, basically. I'm not saying to avoid the realities of life, but everyone has ability, say. So I'm delighted to be here and be able to say welcome to everyone. And I'm just double checking that my screen is working okay, Christabel?
Yeah, absolutely perfect.
Yeah, lovely. Perfect. Yeah. Okay, so I'm just going to throw this out to you guys. But first, I forgot to introduce myself. So I'm Finola Colgan, and I work as Development Officer with Mental Health Ireland. I'm female. I don't know will the picture disclose my age or not, but it's okay. And I false blonde hair, let's face it. And I'm not sure the colour of my eyes. I think they might be blue. I may go and do a double check. And I'm delighted to be here this morning. And I'm living in Westmeath, say. So this is the wonder of Zoom land and media platforms. So I just want to throw out this question to you. Does this sound familiar? We're so overwhelmed with things these days. Our lives are more or less cluttered. I believe it is this, rather than shortness of time. Everyone is hurrying, usually a bit late. Notice that anyone you meet on the street or road have strained faces. It is shortness of time that gives us this feeling life feels rushed and cluttered. I'm just going to give you a moment, and like my general reaction to this, does this sound familiar, is yeah, that just kind of feels like me. But the reality about this wonderful statement is this was written in 1924, almost 100 years ago, by Laura Ingalls, the author of Little House on the Prairie and all those wonderful books that she used to write articles. And here she was writing that in 1924. And here we are 100 years later, feeling the same level of, rush, hurry, cluttered lives. And it's a reality. But the other reality is that, which is worth considering, that since about the 80s, individually, people around the world, and we have an extra 56 minutes per day extra free time, because different working patterns, different everything, and yet what do we do with that 56 minutes that are ideally meant to be stress-free? And again, if we look at the impact of social media, shopping online, rushing around, we're not making the best use of this extra time that we have. So hopefully some of the points being made here this morning will be of some interest to you and worth considering. So before that, I'm going to run Mental Health Stakes Race. So I'm going to line up 6 people, or 6 jockeys. So starting, well, my left is married man, married woman, single male, single female, widower. 6 kind of general categories that represent life in general: married man, married woman, single male, single female, widower. And they're off. And the question is, which horse do you think will win for having the best mental health? Will it be the married man? Will it be the married woman? Single male, the single female, widower. And there's always quite interesting feedback comes to that one, on the basis, you know, like if you're in a mixed up group, and there's men in there say the women, and the women, oh, the men, and on it goes. But it's good to reflect back on what Christabel said in our introduction about mental health. You know what? We can all win that race for mental health. It can be a photo finish if we all look after our mental health. And we're going to explore what do we mean by mental health the next 40 minutes or so. So a little bit about Mental Health Ireland. We're a national NGO since 1966, where we've developed and evolved over the years to reflect current trends and needs. Our key method of working is co-production, consultation, bringing people on board if we're looking to change policies around mental health. We have a network of mental health associations around each counties. There's a team of development officers such as myself covering the general HSE, CHO areas. Peer recovery and education, really important to us. We've dedicated teams of mental health promotion, training, and e-mental health, and I take one of the national leads on that. And then, you know, we're involved with national and international networks as well. And so that's really important. But I think our mission statement is to promote and enhance mental health and well-being, and to create a culture where we're all respected and supported, especially when our mental health is challenged. And we will explore that. And that's a very important piece of, you know, a statement to have, awareness to have in the workplace where, you know, where there are challenges. So every day may not be good, but there's something good in every day. So I'm just going to give you a second to think about what's been in your good in your day so far, albeit 11 o'clock. But since you got up this morning, just think about some one good thing that made a difference to you. Could be having breakfast with someone. It could have been a smile, a thank you. It could have been a good text message. But, you know, there's always something good in every day. And unfortunately, it's the sad things, the things that upset us are the things that play in our mind. But let's keep a balance there. So I'd like this to be kind of the basis of our presentation. There's an Indian proverb that says that everyone is a house with 4 rooms: a physical, a mental, an emotional, and a spiritual. Most of us tend to live in one room most of the time, but unless we go into every room every day, even if we need to keep it aired, we are not a complete person. And, you know, and that's what mental health is about. It's about our physical health, it's about our actual mental health, our emotions, how it impacts, and our spirituality. So health, what comes to mind for you when you think about health, and when you got the invitation and awareness of this session, and why you've come along this morning? Like there's a lot of research done on health, lots of ways of it being presented. We've taken this kind of everyday viewpoint. Does it start with the environment? And we move in and out of very many environments in the daytime. Maybe some of you are working from home right now and engaging in this webinar. Maybe some of you have had to get on a train, on a bus, and go into a place of work. Maybe, you know, you come home from work, that's your environment, it's your home, it's your house, it's your apartment. And also, like if you're obviously traveling on the motorway, that's your environment. But also think about the environment in which you live outside of work. Like, are you in the country? Do you live in a village? Do you live in, you know, where there's a park? But our environment has a major impact, and without going into climate change in itself, but just our actual environment where we work, and we do move in and out of several different environments in the daytime. Societal, so what we're looking at there is how society has a lot to say about everything. I know the big one the last few days has been about the ChatGPT AI and the expose with the Irish Times. It just shows organizations are human Somebody got caught off guard, trusting, which is because this will be the norm, and it's kind of generated a big chat. And like everything that's new and innovative, like there's absolute positives, but sadly there's quite a lot of negatives as well. And it's, so there's a lot going on about that at the moment. And then right in here are our core kind of petals, whatever way we look at them, our physical, our mental health, our spiritual health, our social health, our sexuality and emotional. We're going to be focusing on mental health, but in terms of spirituality, I often hear people say, oh, like, I don't go to mass, but I'm a very spiritual person. And I often wonder why people make the separation in their minds, because to be, spirituality is about what makes you the person you need to be and would like to be. And so that spirituality can come from maybe meditating in a place of worship, whatever that place of worship is. It can be taking that walk, maybe by a canal, it could be just sitting quietly in your own home, outside the door, whichever. But we all have a spirituality, and it's important for us to know that that spirituality can help us when we're stressed or concerned. Our social, for me, I always find this interesting. When people are stressed or feel mentally challenged or vulnerable to anxiety, often they isolate themselves and say, oh, I can't talk about it. But that's the one thing, that's the one really important thing, that we'll all have some friend or some contact, to be able to say, you know what, I'm in bad form, and just generate that conversation, because we all have moments like that. And when we don't keep things bottled up, there isn't like a fizzy explosion when we open the lid. It's more controlled, and it's about prevention. And sometimes the thing we worry about can be managed by just having that chat. And sexuality, male, female, that's it basically. But we also have a bigger understanding about sexuality, same sex, LGBT, same-sex couples, marriage and all that. So that's wonderful support for people, that they can be the people that they need to be. And despite all the legislation, all the everything that's there, sometimes it can be a challenge for people when they feel their sexual orientation is different. And then our emotions, like you could do a whole session on emotions in itself, but our emotions are like a behavior warning sign to us. So if you're feeling sad, what has made you sad? If you're feeling angry, what's making you angry? If you're feeling frustrated, and we have to be able to accept there are going to be moments we'll feel all of those emotions. We'll also have the positive emotions, of course, of love and happiness, and how they can drive us forward. But the important thing I think about emotions is that we will experience them, we need to understand them, and then it's a warning sign, maybe, do I need to talk to somebody? Because we will have times where we will feel frustrated and have those rights as well. That's how we manage them up. So really, like, it's about a kind of a mind and body connection. They're not separate, and hopefully this kind of works well. That when your mental health is good, your physical health tends to be good. When your physical health is compromised, sometimes your mental health can be also compromised. So it's about keeping that balance relative to our spirituality and everything else we've said. I'm not sure that you can define mental health. I'm not in favor of definitions, but that said, sometimes words can help us understand. So one of the ones that's been around a long time, and basically one of the founding fathers of the World Health Organization stated, like, you can't have health without mental health, and that's so true. State of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. What's that saying? So it's also saying something similar in number 2. Mental health describes how we think and feel about ourselves and our relationship to others, and how we interpret events in everyday life. It also relates to our ability to cope with change, transition, and significant life events, and to understand how to deal with the stresses that often come our way. And then the third one here, and I'm going to do a kind of collective feedback on it. Mental health is the state of health of someone's mind, Oxford Good Old-Fashioned Dictionary. But like, when you look at any of those definitions, it's talking about your well-being, it's talking about you as a person, it's talking about how you're coping with things. It's not just talking about, when we have transitions in life. Like, I was listening to an interesting interview on the radio this morning about, people that and with disability, acquired brain injury because of maybe a disastrous accident. There are young people, newborn babies can be born with disability. It's a lifelong situation. And, they're all big transitions for families, for people. And it's also about getting support for people as well. I suppose collectively as a society, the biggest transition we had to deal with was COVID. And at the time, people kind of thought it, was going to go on forever, ever. And here we are, what, good 2 years later, or as good as, and it's like, I know the impact is there, don't get me wrong. We're back and more accustomed to everyday living much quicker than we were anticipating. So really, like mental health, state of well-being, can we actually touch that? Possibly not, but we can feel it and we can experience it. But if we break a leg, we know we have a physical pain and we can see that break, say. So, it's whatever we understand mental health, but the important thing is mental health is not a mental illness. So basically, relationship with yourself, including confidence and self-esteem, relationship with others. How do we get on? We're not going to get on well with all the people all of the time. Families don't always get on. Siblings don't always get on. There'll be phases in life. And then there's times we need to be positive in our relationships because we have to be professional. And then this last one, which I'm going to focus on as well, is ability to cope with life's demands using healthy coping mechanisms. And I will come back to that because that's all important when we are stressed or when we are worried or we feel our mental health has been challenged. And the first thing there, relationship with yourself, including confidence and self-esteem. And that, as we know, will go up and down in life, and we'll get confidence boosters by a good comment at work, that's a job well done, and then maybe somebody might hit in and say, like, what about those mistakes there? So it's very important how we communicate to each other in the workplace and how we address each other. And that doesn't mean you have to ignore an error or mistake. It's how it's communicated, and to be able to hold our confidence in place. So ability to cope with life's demands using healthy coping mechanisms. What does that look like? When we have protective factors, they will help and maintain mental health. And this is the focus of what are protective factors, strategies to support. Because if we focus on, the risk factors that increase the likelihood of mental health difficulties, what does that look like? And, and that can make the difference. And sometimes people, it might be easier to turn to unhealthy coping mechanisms, such as maybe alcohol, maybe drug abuse, maybe not eating properly, maybe not sleeping, maybe just literally not seeking the help we need at a crisis time, and saying, I hold on to it. And of course, we know when we hold on to things, eventually, like the fizz in the bottle and you open the cap, it can potentially explode. So look at that in kind of like the way I like to look at that, because life will throw up challenges, for sure it will. It could be relationships, it could be bereavement, it could be loss, it could be the breakup of a relationship, it could be not, perhaps like financial worries. Like the list can be endless to risk factors to our mental health. When we look at mental health, what impacts on our mental health? And so if you can kind of take on board that on my right hand, my risk factors, what do I have in my left hand that can help me minimize those risk factors and restore balance? Because life isn't going to be a sail through experience. No matter what we do, we'll have our disappointments, we'll have our setbacks, but how do we manage them is really important. Is really, really important. So really the question is, does mental health exist on a continuum? And a continuum suggests from A to B and back again. So if I was to say to you on a scale of 1 to 10, where would you put your physical health? You might say, I might put mine at a 6 or a 7, and maybe not a full muscle in my back, but I can still walk around or whatever. But I know I won't be kind of as active or physically fit until that irritation goes. If I was to ask you to consider where would you put your mental health on a scale of 1 to 10, just kind of take that moment out and where you put it on the scale. But like maybe I say, like if I said I'm going to put my mental health at 6 because I'm worried about something, that doesn't mean I'm going to go down to a -2 or even to a 2 or a 3. I can stay at my 6 again if I look at what are my protective factors, what do I need to do. Like I know in relation to the pulled muscle, should I be going to a physiotherapist possibly? At the moment, I'm using some one of those creams, whatever. But I'm doing something to minimize and lessen the risk of the pain in my back and the pulled muscle. So what do I need to do if I'm worried or anxious? Maybe seek help, seek support. So an interesting guy, and we'll be sharing this link with you. He talked about this mental health continuum from languishing to flourishing. And it's something very interesting and worthwhile to buy into. He does lots of those YouTube talks and the TED Talks and that. And he's a very renowned kind of a guy. And Vancouver have looked in, and I know that's one of the healthiest cities in the world, have looked to his whole idea of this flourishing and languishing. So what does it look like, flourishing and languishing? So what he did was he did a study of 1,000 people between the ages of 17 and 84. He did like a proper psychological assessment. And the thing is that, you know, he measured he did a psychological assessment literally on them. And when he did that, what he came out with that 1,000 people was that that 11 or 16%, that's 16 to be in the yellow box, were flourishing. 54% were what I call moderate good mental health, which is perhaps, you know, the very, you know, good strength-based place to be. 20% had a diagnosis. So what was that diagnosis when he assessed them? Could have been an eating disorder, could have been depression, could have been psychosis, could have been schizophrenia. And, you know, Christabel mentioned it there earlier on, that people at some, you know, people can experience mental illness, and that's when their mental health is broken down. But the important thing is we all have mental health, irrespective of whether we have a mental illness or not. And then this 10% languishing, and this is a nice and interesting one for especially the workplace, because I delivered this in a particular work environment, and the CEO of the organization, he was looking at it and he was thinking, I've 70 employees, and he was saying, oh my goodness, 10% are languishing. What's going on there? And it kind of, you know, to watch out for that, you know, where somebody is languishing, how we can support that person. And at the other end of the scale, of course, 16% are flourishing and looking after themselves. And if you can think, are there days when you feel you're languishing, just kind of pulling yourself or just kind of getting yourself there, or you don't necessarily feel very motivated? I know if you're in the country, we might call it being stuck in the rut. But so what does that look like? You know, you feel good about life, optimistic, able to create change, you keep stress at a low level. You're feeling hollow. This is the other side of it. Unhappy, feeling you cannot make change, feeling isolated, maybe lonely, prone to stress. But you see, the point is we can all move in and out of those states. And that's again kind of brings back, you know, feeling like isolated, lonely, prone to stress. That's again is back to, you know, the importance of talking, getting support, minimizing the risk of that, where that might kind of slip in on a person, you know, where we're languishing, and about what can we do within the organization, just even within our own friendships. So when I talk about mental health in the community, in the workplace, what are the challenges? And I know if we were in a room, there could be lots of interesting points made, and the biggest word most likely will call to recognition will be stigma. Like, but why do we attach a stigma to mental health? Like, mental health is perfectly a normal part of our lives, so it's physical health. But why like, is there that stigma? Because the stigma can impact on how people feel about mental health and whether they want to talk about it. And like Christabel mentioned, the statistic that 1 in 4 people can experience, but you know, that could be 1 in 5, it could be 1 in 6, it could be whatever it is. The reality is that we're all there. And the thing about, like, say, if I'm that one person at work that my mental health is challenged, I'm off work as I'm entitled to be, no more than if I had any other illness, disability, setback, a need to be off work. How do people in the workplace then end up talking, especially if I'm off work due to depression or anxiety, as the case may be? And so, the chat can be helpful, it can be positive, but it can be negative. But the thing is, if I'm in part of that discussion of the 3 people and I've experienced a mental health challenge, I think, oh my goodness, do you know what they're going to be saying about me? So that's why in the workplace, we need to have a positive understanding, insight. And it's not about, it could be about empathy, depending on the circumstances, but also it's about compassion. And that compassion could be self-compassion, but it could be a group compassion as well. And, you know, to kind of know the situation. Like, say if I was a teacher and I'm off work due to mental health, and I come back into the staff room, well, like, you know, people might know maybe I've been away, you know, getting help, getting support. Sometimes people can feel uncomfortable, but if we have a positive understanding, that can be so much easier about how things go. So the question is, how can we support ourselves and others around us in moments of crisis? So hopefully this will play. It's only 3 minutes long.
Whoa. Can I help you?
With John's mates. Is he around?
Yeah. He's over there.
Cheers, mate. Right, John. Right, boys. Go sit down.
1 in 4 of us will fight mental health problems this year.
You can do this, John. We're with you. We're with you, mate.
Having a mate in your corner can make all the difference. So if your mate's acting differently, step in.
There we go now. The bell's out.
Search Time to Change.
So that video is around quite a while. It was funded by Ford company. It emerged that the director, the UK director, had a family member with mental health challenges, and he got involved wanting to kind of create a better understanding. But it, you know, like I could say to you, if we were setting that in the workplace, your workplace, what might that look like? If you were like, if it was to be about women, where would they set that? You know, but that conversation can take in very many different places. And I was listening to a very interesting podcast over the weekend where somebody in the UK organises these, what you call walks of hope. And the idea is to encourage people to have chats about what's troubling them, and it's facilitated, but it's taking in nature at the same time. So like we've talked about mental health, and the interesting definition again about well-being, it so reflects mental health. So well-being is present when a person realizes their potential, is resilient in dealing with the normal stresses of their life, takes care of their physical well-being, and has a sense of purpose, connection, and belonging to a wider community. It's a fluid way of being and needs nurturing throughout life. It's a very interesting understanding of well-being, and it's one we could obviously delve into. So if things are going well, we can feel confident, we can, you know, we're looking after physical health, eating well, getting a good night's sleep, doing whatever exercise we like to do, you know, where we feel part of a society, part of a group. But, you know, sometimes we can feel isolated, and that can impact on our well-being, and people can get isolated very easy. And again, you know, our understanding of mental health is so important in this regard. But always remember that we all have well-being, and even when our mental health is challenged, you know, it's important to look to our well-being. What do I need to do to make things better for myself? So that brings us on to like having a strategy to support your mental health and well-being. And, you know, we bring the car for the NCT. We mightn't like to be doing it sometimes, but it has to be done. And it's like a check-in, kind of like what needs to be done. Do brakes need a bit more oiling, or you bring it back because a bulb isn't, whatever. But, you know, think about, what do I need to do to look after my well-being? So there's this evidence-based 5 ways to well-being: connect, be active, take notice, keep learning, and give. So the Mental Health Ireland, it's a universal message, the very same as eating 8 greens a day. Very important for, you know, we get very definite messages out there. We don't get as many messages around mental health, or the people don't make, the advertisers don't make the link between, you when they're advertising physical health, just to simply say, you know what, this is also good for your mental health, and break down those barriers that, you're looking after all aspects of your health. So we're going to explore these in a video clip, and just looking for, here we go.
Did you know there are things we can do every day to improve our mental health and well-being? Connect. Connecting is about building and strengthening relationships with the people around you. We can do this by spending meaningful time with people each day, arranging a day out with friends, having lunch with someone you work with, or joining a sports team in your local community. By giving time to these relationships, we feel happier and more secure, giving us a better sense of purpose. Be active. Look for ways to be active every day. Find something you enjoy. It doesn't have to be a marathon, but something that suits your fitness and mobility. Cycling, gardening, walking, and dancing are all ways that we can get more active. Being active every day causes changes in our brain, which can positively affect our mood. Take notice. To take notice is to be present in the here and now. Pay attention to the world around you, nature, people, your thoughts and feelings. Becoming more aware of the present moment can help us enjoy the world around us and understand ourselves better. Keep learning. Keep learning is about learning new skills and information about topics that interest us. We can keep learning by trying a new recipe, signing up for a nighttime course, fixing that broken bike, or taking on a new responsibility in work. Learning can boost our confidence and self-esteem, help build a sense of purpose, and help us connect with others. Give. Giving is about small acts of kindness for other people. You could make someone a cup of tea, sign up for volunteering, or offer to help someone you know with a project. You could just ask a friend or someone you work with how they are, and really listen to the answer. Giving back to others can create positive feelings and help us feel more satisfied with life. Each of the 5 ways have been shown to make a positive difference in how we feel and live our life. By including these simple actions every day, we can improve our mental health and well-being.
Okay, as I was saying, it's a universal message. It's massively used, I was trying to say majorly used in the NHS, very many organisations throughout the UK and various kind of English-speaking countries, because the evidence is there that these 5 ways to well-being can make such a difference. And when we look at them, like, who do we connect with? You connect with yourself, you connect with other people, in terms of how you're feeling, but also connecting with people when, you're their supporter. How do we connect at work? Do you have team days? Do you have outings? I know lots of effort went into having connections between people working from home. I'm not sure what the status of that is now, but it was so important during COVID. But, there's a whole industry around the water cooler where people might, how things, opportunity for discussion. Like, there's again a lot of research done that, and a lot of organizations put a lot of time into that. So the connect, be active, can be just taking a 5-minute stroll, maybe leaving the office door, leaving the office building, just go down the stairs, go out the building, walk around, just taking a deep breath, and whatever, just stop making that, being active. It doesn't have to be the 1-minute mile, or well, there's no such things as you, but that said, so be active, take notice, also to take notice of how you are, what's going on around you, because when we are aware of how we are, that can make such a difference, and how other people are, because that can impact on our communications as well. So if you're in communication with somebody and you kind of notice, maybe their mood isn't great or things aren't right, make it kind of a personal call on that and say, will I give it space, or do I need to give myself time? And we know sometimes we send back that quick email and whatever. I'll say, what, give myself 10 seconds on this. and say, do I really need to send that email, and or can I make it shorter than what it is? So connect the active, take notice, keep learning. Like hopefully this morning is about learning, but also to be learning about what it is that motivates you, what are your own personal interests. And we have wonderful libraries in every community now. You can have free books through BarraBox, but we also have what I think is another wonderful organization, Aintus and our adult education, where they have courses. Now there won't be that many from now on, but come up the autumn, like what are the interest courses, and we have all these SkillNet programs, that we can just learn for ourselves as well, Spotify and listening. And the other one to give, so we gave, and Mental Health Ireland recently launched their volunteer strategy to support volunteers and new volunteers that are interested in being involved with the organisation, both nationally and locally. But that's really important. And I know, like, Irish people, by their absolute nature, are massive givers, but it's very, very important to give to yourself. Give yourself time, like you've given this morning, taking an hour or so off work. Give yourself time, because why? You're worth it. And that time could be, if you're busy doing a shop and trying to keep a household together, give yourself time before you, like treat yourself to something, a bar of chocolate, a cup of coffee, whatever it is, because it's very important that you look after yourself, because we can get burnt out very, very quickly. We can send this, give it to Christabel, but it's also on our website, mentalhealthireland.ie. All these resources are up there. Like, to look and see yourself, what time do you spend in each of those areas? Not at all, not very often, some of the time, most of the time, always. Now, we can't go, and we're not going to get the perfect score. And a bit like the flourishing and the languishing, there'll be days like you could fill that in today, and you might, because you're feeling flourishing, you're feeling in a good place, you're feeling in control, things aren't too bad, but next week, some little change could happen, and you might feel a little bit different. So the 5 ways to well-being, if at the end of the day you can say, I connected, I was active, I took notice, I learned something new, and I looked after myself, I think can make such a difference. And remember, and these are on our website as well, what can you control? Like, because we all have the power to control. There are certain things, like if you have to be at work, you have to be at work at 9 o'clock. There's rules and regulations, expectations, safety in the workplace, health and safety, and all that goes with that. But, and we all have responsibilities, both as an employer, as an employee. And, so I can control my contribution to that as well. And to be where I'm meant to be, and if I have to wear safety equipment, whatever it is I have to be mindful of, I can control. I can control kind of, if I'm worried about something, can I control that by seeking help? Like most organizations, especially at different levels, most organizations have employee assistance programs. I sometimes pick up that people might be reluctant to use it because they kind of think maybe because the organization is paying for it, and somebody in the EAP service will be communicating like it's like absolutely not, because number one, it'd be totally unprofessional, but more important, to be unethical. And I know someone that said to me there not so long ago, she said, she said, Finola, I actually use the service even if it's just for a chat, just to reassure myself, because the organization is paying for it, and why not use it? And maybe having that ordinary chat could make all the difference. So again, all these resources are on our website. I love this video. You'll see why in a minute. And hopefully this is what sums it up for us this morning.
Not so long ago, many scientists believed that the brain did not change after childhood, that it was hardwired and fixed by the time we became adults. But recent advances in only the last decade now tell us that this is simply not true. The brain can and does change throughout our lives. It is adaptable, like plastic. Hence, neuroscientists call this neuroplasticity. How does neuroplasticity work? If you think of your brain as a dynamic, connected power grid, there are billions of pathways or roads lighting up every time you think, feel, or do something. Some of these roads are well-travelled. These are our habits, our established ways of thinking, feeling, and doing. Every time we think in a certain way, practice a particular task, or feel a specific emotion, we strengthen this road. It becomes easier for our brains to travel this pathway. Say we think about something differently, learn a new task, or choose a different emotion. We start carving out a new road. If we keep travelling that road, our brains begin to use this pathway more, and this new way of thinking, feeling, or doing becomes second nature. The old pathway gets used less and less and weakens. This process of rewiring your brain by forming new connections and weakening old ones is neuroplasticity in action. The good news is that we all have the ability to learn and change by rewiring our brains. If you have ever changed a bad habit or thought about something differently, you have carved a new pathway in your brain and experienced neuroplasticity firsthand. With repeated and directed attention towards your desired change, you can rewire your brain.
Okay. I don't know why it's not moving on. Okay. So think about that, guys. For me, when I saw that first, I live in Westmeath. So when I'd be going to Dublin, Kilbeggan, Turns Pass, Rochford Bridge, I think Kinnegad was next. And next thing, we got the wonderful motorway and €3, whatever. And I said, like, why would you pay €3 to drive on a main road? And I'd go the old way. And then, of course, one of the days I'm in a hurry, I'm running behind time, and I know what, pay my €3. Did I ever revert back to the old way? No. You know, so we can rewire, we can adjust, we can adapt, say, and to have the confidence to do that. And they say it takes something like 27 days to change a habit. I know the big challenges around changing habits might be around smoking in particular. A lot of emphasis on that, and to say, like, if you can kick the habit, and we see the ads and that, but we can change by just making incremental changes, nothing massive, nothing major, and just, like, as I say, you know, small steps can make such a big change, and not to, you know, be going for broke ultimately. And that's what I like that video, because even if you were to look back and some of the habits you have changed, or they've been changed for you, or you've been encouraged, and the difference, the quality of life it can make for you. But it's about having that confidence and belief in yourself as well. So I came across this over the weekend, very interesting person, this Julian of Norwich, going back, I think, to, I don't know, the 16th century. And I listened to a lovely story about her on Woman's Hour, Spotify anyway, and a lot of chat about words of hope and the difference it can make. And we all have words of hope. We say, I hope you're doing well. We might drop an email. We'll all have our own kind of positive mantras, like every day may not be good, but there's some good in every day. Like little things like that keep us motivated. But I thought this was an interesting one that came up. All shall be well, and all shall be well, and all manner of things shall be well. So that's about hope, isn't it? That's about confidence. That's about trusting and being able to move forward, basically. And, you know, when we're in that phase, perhaps this is when we end up kind of feeling flourishing. So, you know, living in the country, husband for a farmer for a husband, whatever way it goes. And here we go, take a rest. A field that has rested gives a beautiful crop, basically. So I know it's kind of strange for me talking into screens, so I hope that has made sense, Christabel. That concludes my presentation. I don't know, do I stop share now, or?
Thank you, Finola. Yeah, you can stop sharing, and we'll just have a chat.
Yeah, look, their needs. Yeah.
So thanks a million. That was really, really interesting. Something that occurred to me actually when you were talking there about the kind of strategies for well-being and the connect, keep active, keep learning, take notice, and to give. I was thinking about how those might be used by maybe managers in a broader work context to promote mental health and well-being at work.
So they're an ideal package in a sense, because and there are many organizations use them, and they produce their own activities to go with them. So they might say, you know, the way where you'd have a team day at work, they might say, we're going to make today a connecting day. But they can incorporate all 5, because in developing that connecting day with staff, it's about connecting, it's about people being active, taking notice of what's going on. It's the organisation caring for their staff. It's employees giving back to their organisation. So that's a massive give on both ways. And then about learning, it's about implementing kind of, I think, less is more in life, and a lot of the times, and that they don't have to be big, massive kind of changes, and to encourage, or maybe like, you know, I read an interesting article, like this week is a mental health week in various parts of the country, Europe, etc. Mental Health Ireland, World Mental Health Day is 10th of October, and then big emphasis. But the thing is, we all have mental health, and we all have mental health every day of the week. So it's not just something exceptional. And a lot of the times when our mental health is challenged, it's something in life, it's some trigger, it's something that's upsetting us. But as you said at the beginning, it's not about mental illness, no more than my, you know, like say if I had diabetes, like that's one part of my physical health impacted, but I can still function as a person, can't I? And if I am anxious about something or stressed, like it's going to impact on me, but I'm still a person, and the way to do it then is, do I go and do I seek help, go out for something?
Yeah, I think that's so true, because people do get a little bit, I think, uncomfortable when they think that they don't have maybe expertise. And it's funny, because when we actually met the first time in Tullamore, you were handed out these books, and that's what got me on thinking. And these are great, actually. I was even looking at it yesterday, and it was saying, you know, as a manager, you're not actually there to diagnose, to deliver prescribed treatment. And people get very lost in that, probably.
And with that book is free to download as well on our website. And we've developed Wellness Works. It's just, you know, designed to meet. We have the whole. I must send it to you. Actually, you can share it. You know, guidelines for in places of work, and we're there to support that as well. You know, to run a workshop or whatever. Say.
Brilliant.
So I took, like this morning was to introduce the awareness and to break down kind of any barriers. And like at the end of the day, whether like you're an employee, a supervisor, a leader, a manager, like we all have mental health. We all have to look after our own mental health, no matter what level of we are within the organization. And perhaps the further up the line we go, the greater the stress in a way. And depending on the organization and the company, like I know back a few years, but I was trying, well, maybe 100 years, but anyway, I was trying to get my kids out to school, and there wasn't one of them cooperating with me in the kitchen. And it was one of those days where I couldn't afford to be late. You know, sometimes a bit of flexibility, but it was definitely one of those mornings. And I thought, oh my God, I said, I can't even manage my own stress in my own kitchen. And I did get out to that car quick, or else walk to school. You know what I'm saying? We're all human at the end of the day.
Yeah. And somebody has actually a very good question here. They've said, which of the 5 ways to well-being would you advise the most investment in within, let's say, the retail? So this person works in retail. They're talking about team members who work on the shop floor. So is there any one?
Okay, yeah, it's always kind of like as I say, it's a universal message. Like you could Google the 5 ways in the morning, and you could find them in a different order, and we put thumbprints with them. Like, you know, something, like what I kind of believe. Okay, I think give is important, and give yourself. And if you in that giving, if you connect, be active, take notice, and keep learning, and give the 5 ways to yourself, then they're all important. But maybe to start with the give, I like give to myself and incorporate all 5. I'm not sure that one is more important than the other, but I tend to think that when we give ourselves time to look after ourselves, I know it's difficult if you're, especially in retail and dealing with the public, can be very, very challenging, because the public can be very challenging to deal with and to keep satisfied. It's kind of one of the challenges when you're in a public sector or in a public service, but that's why it's important that we keep ourselves well, be able to handle with those situations. So I think I can't say that one is more important than the other, but I do think if we start giving to ourselves, using the other 4, then I think we've got a good package for ourselves.
Yeah, I think that's a really good point. Probably the one thing that maybe like employers and managers might have a little bit more control over is ensuring that they're providing the learning opportunities for people to kind of grow and to feel that kind of degree of support. And you read a lot about that now, actually. You know, you have companies who will say, look, we're not in a position to provide kind of salary increases, but what we will do is we'll give more time to people if they want to do kind of different learning things. So I also see we have a question in here from someone who's looking to see if you have any suggestions around encouraging staff to use the company employee assistance program.
It's interesting, isn't it? Like, I just pick this up so regular, and Finola, like, sure, if I phone that, like, next thing the manager be on, and I say, no, hang on, it's a professional service. The person providing it is bound by their own code of ethics and everything. So maybe it's about maybe developing an information session around the benefits, and maybe to get, like, what would we say, a champion of now, I know that can be difficult because somebody might want to put up their hand and say, I use the EAP, but maybe to put out positive messages about the EAP, because like it is like, it's about the chat, isn't it? And sometimes the chat can dissolve the problem for the person and put things in perspective, or they might give them the confidence what they need to do to address the issue. But you're not, like, it's very difficult for you to do that in your own organ. Like, for you as an employee, it's very difficult for you to do that. You need a bit of confidence, because we see more barriers than anything else says. So I think maybe to promote the benefits of that and how it can support your well-being, basically.
I'd also actually maybe suggest, because Finola, I previously in a previous life introduced an employee assistance program, and people can be a little bit skeptical because, as you said, they're worried that you actually get information about who used it. And then the information that managers or the organization would get is so minimal and broad. They literally would find out how many people have used the service in the year. So it has just occurred to me, actually, that to give a mock example of what a report looks like that goes into the year to managers, that gets shared when you share information about the service, might be a way of kind of demystifying the information that's through the organization. And really help people to use it.
And maybe people are using it but not declaring it. That would reinforce that point. And maybe it reflects well that if it's not being used, maybe it's not because people are reluctant to use it. Maybe they're quite happy. But the important thing is that it's there to be accessed, and it's not just a tick box exercise. But I think, if you have a champion in the workplace that can promote awareness of mental health positivity, and that the organization has a policy, if you have to take time off because for whatever the illness reason is, it doesn't matter whether it's physical or mental. And there's a lot more understanding now, I think, and an awful lot of research done on that as well. And there is now, the ISO, like, they now have introduced a mental health ISO now for workplaces, if workplaces want to subscribe to it. Obviously, it's an expensive process, but it might, for any employer that's here this morning, they can come back to yourself or myself, and we can link them in with Wellness Works. I'll definitely send all that information to you anyway. You can send out to anybody here this morning, Isabel or Christabel.
And we can circulate that, absolutely. See here, somebody else has put a message in, Finola. If there is someone on your team struggling with depression, anxiety, or burnout, are there any practical tips or approaches managers should take?
Okay, that's a very, that's a regular question. That's a very loaded question. And then it's also, the tips for managers book. The challenge there is you have to be, number one, you're not, as you said, you're not there to diagnose or to, what shall I say, just to, you're not there to diagnose or be a therapist or be a counselor, right? But you have a duty of care as a manager. So a starting point might be to sit down with the person and ask, can we have a conversation? But again, you have to be so careful because, you know, maybe it might be misinterpreted. So how you conduct that conversation is really important. But the first step is to engage in the conversation and to be able to say, how is everything going for you? Do you know we're here to work, to help you? And that's back to the communication, isn't it, Christabel? Basically,
Yeah.
but not to kind of say, not to, obviously, I know I don't want to sound like it. You wouldn't go and say, I see you're very depressed. I see you're not cooperating. You don't go for any of that stuff. Say,
Yeah.
So communication is extremely important. And that's why, again, like, it's about training for managers as well. It's literally for training for managers as well, how to approach dealing with that. And, you know, like, I can only give a kind of a guideline now, but about common sense. But we've heard the stories where employers have not been successful in their engagement, and it has kind of backfired.
Mhm.
Yep.
Yeah. So look, I'm conscious of the time.
Yeah.
We will send on, and we've lost the ISM interpreter, unfortunately. We will send on a follow-up email to everybody with information from today's session. We'll also include, I see 1 or 2 questions there, and I'll get answers for those, and I will include those as well in that. And we'll put in some links like to the tips for managers and things booklet that people can use. Really, really practical and very helpful. Finola, thanks so much. That was really
pleasure.
great, really enjoyable. We had
well
so many
done.
people send comments into us saying that they really enjoyed the session.
Brilliant.
So thank you very much. And I hope the people will, after this, take an opportunity to look up Mental Health Ireland, to see some of the great resources that you have, and to have a look at employersforchange.ie.
Yeah, and also to say, like, we're there and we can go out to workplaces as well, or we can do something online as well. I wanted to call you Isabella, like Christabel. We're there to support, basically. 100%. Yeah.
Brilliant. Well, thanks so
I've
much.
enjoyed it. Yeah. So thanks very much to everyone there, and for listening.
Thank you.
And being patient.
A great way to start your Monday. Thanks very much, everybody,
Not
and
at all.
enjoy the rest of your week. Thank you.
Bye.
Bye.